truly honored to be here. I'd like to thank Dr. Steele, First Lady Steele, the SCLC board that I have the pleasure of sitting with and meeting some of them for the first time, and Dr. Rashad Ritchie for the opportunity to speak with you today. Again, it's just an honor to be part of this. I'm here today because I want to bring an injustice to your attention. As you know, there are many injustices. I don't have to tell people in this room, but this one is personal to me, and I'd like to share it with you for the next few minutes, and perhaps you will consider sharing with what I have to tell you. As a physician, the most egregious moment I can think of in the history of American medicine is the Tuskegee experiment. I had the opportunity to speak recently at Tuskegee, and when that came to light and officially ended in 1972, the government told people it would never happen again. Because now there's informed consent, and anyone having a medical procedure or enrolling in a medical trial would have to be informed of all of their options, risks and benefits of each, and the patient would choose which option they desired. Fast forward about 50 years. What if there was a condition, instead of affecting around 1,000 African American men, affected tens of millions of African American women, and made the lives of these women absolutely miserable? What if this condition significantly increased the likelihood of preterm birth, pregnancy complications, miscarriage, infertility, even sterility? Despite being a benign, non-cancerous condition, what if it was the most common reason why women undergo hysterectomy in this country? What if the annual cost of this condition to the U.S. healthcare system was estimated to be around $34 billion, on par with the cost of breast, colon, and ovarian cancer combined? What if there was no effective medical treatment for the condition? Of course, there is this condition. It's called uterine fibroids. Other than obesity, it's difficult for me to imagine a more pressing health issue for women in the United States, and yet there is no urgency to examine this problem at all. The public health and economic burden of uterine fibroids is immense, particularly to women of color who disproportionately suffer with fibroids. They're the most common pelvic tumor in women. As I mentioned, they're benign. However, they can cause significant issues for many women. Menstrual periods lasting for 1 to 2 weeks, episodes of blood flooding or gushing out of them, passing fist-sized clots are all some of the symptoms that these women will endure month after month. They often can't work due to the disability, embarrassment of this condition. They cause pain, they cause pressure, increased frequency of urination, even urinary incontinence. And they are 3 times more likely in African American women than Caucasian women of the same age. These women have a compromised quality of life and impairment in many domains, including work productivity, sexuality, self-image, relationships, social, emotional, and physical well-being. Unfortunately, most women are only offered one option for relief: surgery. While hysterectomy does end a woman's fibroid problem, it comes at a very steep price. Women facing this decision are typically in their 30s and 40s, and sometimes, as I found at Tuskegee, in their 20s. Losing one's uterus at this age can obviously be devastating, even if the women have completed childbearing. The after effects of hysterectomy include depression and despair from losing their womb, loss of sexual desire, urinary leaking, and immediate menopause. However, there's a way out. Almost 25 years ago now, an interventional radiologist in France made a remarkable discovery. He discovered a non-surgical procedure called uterine fibroid embolization, or UFE, which was rapidly adopted by interventional radiologists like myself in this country, and provides the solution that women need and is covered by all insurance providers, including Medicare and Medicaid. It's a revolutionary outpatient medical procedure. UFE has a long track record of safety and efficacy, and patients experience relief of symptoms in 90% of the cases and completely avoid the risks and long recovery of surgery. Patients are discharged after several-hour recovery with just a Band-Aid. They'll recover at home over 5 or 6 days and return to work within a week, typically, versus 2 months or more with surgery. UFE is safer, it's less invasive, the recovery is shorter, and most importantly, woman gets to keep her uterus and preserve her fertility. Why don't women know about UFE? Largely because the gatekeepers of women's health are gynecologists, and gynecologists are surgeons, and we all know what surgeons like to do. Many studies have shown that most gynecologists fail to mention UFE as a treatment option to patients with symptomatic fibroids. So in a sense, in a small sense, this is Tuskegee all over again. Failing to mention a treatment option which could dramatically improve the quality of life for the affected individual. Because of this, the average woman waiting with fibroids waits over 3.5 years for treatment, with a quarter of them often waiting over 5 years, many of them hoping they'll just go into menopause. They don't want surgery, they don't know about UFE, and so they suffer in silence. There are over 1 million women in this country right now on the sidelines suffering. It took 30 years before the Tuskegee experiment was halted, and in fact, the person who officially apologized on the behalf of our government on the 25th anniversary of the end of the experiment was President Bill Clinton. I kind of wish he was president now. UFE is one of the biggest medical breakthroughs for women, particularly women of color. I encourage you to share this information on UFE. Just this week, our representative and friend, David Scott, introduced House Resolution 488, which declares July as Fibroid Awareness Month. And we are promoting the hashtag, Don't Lose Your U. U obviously stands for uterus, but when a woman loses her uterus, she often loses her YOU, what makes her a woman. And we don't want anyone to lose any of their U's. Please share this information, help our grassroots effort to end this healthcare disparity and unnecessary amputation of women of color. Thank you for your attention. Thank you again for the opportunity to be part of this prestigious meeting.